If you're going to have a pituitary tumour removed, then here's a rough idea of how recovery will look. So in the week leading up to your surgery, you'll have your pre-op tests. This is where they measure like your weight, your height, they'll take your blood tests and you'll fill out lots of forms, and then this is where you can ask any questions you've got. Thankfully, as it's a transsphenoidal surgery, it's through your nose and not through your skull, so you'll be sedated throughout the surgery. They will give you these details at pre-op, but you're not supposed to eat from about midnight, and I think drink from about like 5 or 6 in the morning. So if you've got any medication to take that day, you normally take that around that time. And then when you're in the hospital, obviously you have to get changed into the hospital gown and the compression socks. They won't tell you how long you'll be in surgery for, as it's different for everyone. I think mine, I was in there for a few hours, but once you're out of surgery, you're going to be in the critical care unit where you'll be constantly monitored for a good few hours. And also when you come out of surgery, you'll have like a little bandage under your nose to collect any blood. I just kept replacing mine for the time that I was in hospital every day. But yeah, you'll have like some blood and stuff coming out, and you'll also likely have like a dry throat and mouth from surgery, as you'll have like the tube down there when you're under. At least 2 nurses sit with you for the whole time. They will constantly monitor you, and they will help you with like painkillers and also monitor for a CSF leak. So that will be where it's your spinal fluid, so they'll be looking for like clear fluid running out your nose, but it will be like constant, like a tap. I was really surprised that as soon as I came out, I was actually able to breathe through my nose. I think I had a little bit of blockage for maybe a day or two, but the rest of the time I could breathe through my nose, but I wasn't able to smell or taste for about 2 months, I'd say. So once you're out of the critical care unit, they'll put you on the neurology ward, and yeah, like I said, you'll be in there for like 3 to 5 days. It's a difficult ward to be in, I'll be honest. I would definitely recommend taking like noise cancelling headphones and earplugs. You'll be in there with people that have had like strokes or brain damage and things, so it can get a bit noisy. So when you're back to the ward, I think they first of all do your obs every hour for, I think it's like 8 to 16 hours. I was kind of out of it, so I can't remember exactly. But your obs are where they check your blood pressure, I think your oxygen levels, and then how many breaths you take per minute. I think it goes from 1 hour to then 2 hours, and then either 4 hours to 6 or 8, I can't remember, but it just reduces every few hours basically for the duration that you're there. You'll also be given a chart where it will have the time every hour, and you have to write how much liquid you drank and what liquid it is. I'll put a picture here as well, but you'll likely have to use a commode, and you'll have to let the nurses know every time you go for a wee, and they will measure your urine output. So the reason that your liquid intake and output will be monitored is because one of the side effects of the surgery can be diabetes insipidus, and this is basically where your body isn't able to kind of manage its water intake properly. If there's any concern of this, what will happen is they will do another blood test just to check your electrolytes and see if you're showing any of these symptoms. I had extra blood tests, I think, on day 1 and 2, just because I was drinking so much and I was just weeing constantly. But I think part of it was because my mouth was so dry that I was just drinking much more than I normally would. But I was genuinely, on the commode like every hour, and there was so much coming out. But my electrolytes were fine, so I didn't have that as a side effect. I don't know why. I thought I was going to be really snatched, but the nurses didn't take that as an answer and still made me have the blood tests. You will have blood tests every morning, first thing in the morning. I think mine were about 6:30 to 7 o'clock every morning. So what happens with these blood tests is they check all of your hormones and just see how your levels are compared to before surgery. And then every day that you're in hospital, you'll also get a blood thinning injection in your stomach. I'm not very good with needles, so honestly, this was quite a difficult process for me. One of the things that I was told pre-op is basically that the pituitary gland is a diva, so anytime anything touches it or it's moved in the slightest way, it can basically go on strike and stop working. And that's kind of what happened for me. So I ended up having adrenal insufficiency where my body wasn't making cortisol anymore compared to how it was beforehand. They normally hope that in like 6 weeks after the surgery, when you go back for tests, that it's gone back to normal, but unfortunately in my case it's still on strike. I find this really weird because obviously like my tumour was big enough that it was pressing on the pituitary gland itself, and it was like crushed, but it was working fine before that. So it was really strange that as soon as it was removed and kind of placed back to normal, that it's just not working anymore. So whilst you're in hospital, you'll have your blood tests and everything that I've said, and then each day you will have someone from the endocrinology team come and visit you, and also the neurology team, and sometimes a doctor. So if you've got any other questions, you can just ask them when they're there. But yeah, basically I have had adrenal insufficiency as soon as I had the surgery. So I was on steroids 3 times a day in the hospital, and then they've had to prescribe them long term for me at the minute. I think I'm due another blood test again soon just to see if the cortisol has improved, but at the minute it's not. And what this can also mean is basically if I vomit or if I have diarrhea and for some reason my body is not able to absorb the steroids, which would normally mimic your body's normal cortisol, I could go into adrenal crisis, which is a medical emergency, and I could die. So I have to have a bracelet on me all the time that basically says that I am adrenal insufficient, and I also have to carry around like a little medical bag with needles and medication in case I am in a crisis. And I've also got like an NHS medical card and stuff to carry around. So yeah, basically if I go unconscious and a paramedic comes, then they can see what dosage I need and how to do it. So like I just said, I have to have blood tests about 6 weeks after surgery. I think everyone does, just to kind of check all your hormone levels, but for me in particular, they were looking at my cortisol levels, just to see like how you're healing and like if everything's back to normal. So yeah, for me, I was hoping my cortisol was sorted, but it wasn't. So hopefully you'll come home about 5 days after, maybe a week if there's complications, but about a week after you've had the initial surgery, you'll need to start nasal douching. You need to do that 3 times a day for 6 weeks. It is sore at first, I'm not gonna lie to you. It's like putting salt water in a gaping wound, but as the days go on, it recovers quite quickly. So it just becomes kind of like business as usual and just a chore really. And you will also have to see the ENT team, which is the ear, nose and throat team, about 2 months after your surgery, just to see kind of like how you're healing. They kind of put like a camera up your nose, look around the surgery site to see how you're doing. I think for me, I was still getting headaches and I had quite a bit of pain here, but it was because I ended up having an infection in the surgery site. So I got antibiotics and then I had to go back about 2 weeks later, and then I was cleared from that department. I think around that same time, you'll also go back to the endocrinology team. Unfortunately, they're not really able to give you much insight about long term because they kind of need to wait for the MRI to give you the results on like how everything is there. I had a few questions obviously about like cortisol and kind of like what the expectations would be for me, but basically they were saying that they need to see how it is like in my head and how it's healing, because for me, they weren't able to remove the full tumour. They had to still leave some of the tissue on there, because if they were going to pull it off, there was a chance that it could have damaged the pituitary gland itself, and it's obviously it's like a pea-sized gland and you don't want to touch it because it's so sensitive anyway. So it was easier to leave that tissue on. They said that there was hope that with the majority of the tissue taken off, that remaining tissue would die off, but if not, it could stay there and stay as it is, or it could continue to grow. So normally when you have this surgery, it's quite rare to be in someone as young as me and to be found. It's normally found by chance and you don't have any symptoms, whereas I did have symptoms. I think you're normally like 50s and 60s when you have this surgery. So if they were going to like go into the pituitary gland, it's not too much of an issue because they could do medication. But for me, obviously, they just didn't want to risk it. And if I do end up having a baby one day, I will have to go back to this hospital every trimester, because the hormones that your body creates when you're pregnant are also the same hormones that basically trigger like the growth for this tumour. But yeah, the tumour itself can cause fertility issues. So the hope is now that like the majority of it's gone, that hopefully I will be able to have a baby one day. But yeah, if I do have one, then that is another concern basically that's on top of that. So long term, again, they didn't really give me too many details. I think I'm likely going to have to go for yearly MRIs in the beginning, and also additional eye tests, obviously, just to see if this tumour is growing and if it is going onto the optic chiasm again. I think it starts off as 1 year, and then depending on how you continue to get on, I think they can kind of extend it up to like 5 years before your check-ins. But yeah, I'm not too sure what that is. I'm still waiting for my MRI results to come back, so I'm really hoping that I'm really hoping it died off, but I'm just in my head thinking at least if it could just stay the same, then hopefully that's positive. I think as well, it takes a while for them to kind of come back with the results of the tumour, so it was really strange for me. So One of the symptoms that I had before having it removed was that my prolactin levels was very high, and as soon as they'd removed the tumour, it was back to normal. So I thought that the tumour itself was creating the prolactin, but it wasn't. It was where it was pressing onto the pituitary gland that it was doing that. So the tumour itself, for me, I think it's called ACTH, so it's like a growth hormone. And normally what would happen is that hormone would, if it was producing that hormone, it would be really high and I would have like Cushing's disease. But I think it's called like a silent tumour. So the tumour itself is made of the ACTH, but it's not producing it enough for it to be in my bloodstream or anything. I'm not too sure how it works. That's kind of like my understanding of it. So basically, now that it's taken off, I think that's where the low cortisols come from, because like something's messed up. So yeah, I'm not too sure if like adrenal insufficiency is something I'm going to have to live with for the rest of my life, now that that's been removed, or how it's going to work. But yeah, it's just very, very strange and not something that I've ever known about, obviously. Like, who would, unless you study it? But yeah, it's really interesting, and I've definitely learned a lot in this journey. This is probably a really long video. I hope it's helped a little bit. If you've got any questions, obviously, please let me know and I'll do my best to help you.